It creates this whole kind of trail of disaster behind you because of the way that you are being is problematic for everyone around you. What is narcissism? Someone just asked about that, and I think, and I will kind of tie in also the next question of, are they ever aware they're narcissistic? So narcissism, as I said in the beginning, is based upon what's observed. And so when the founders of the DSM-3, which was the big major transition in the way we think about mental conditions, and it came out in 1980, that's the first time narcissistic personality disorder actually showed up as an observable condition to be diagnosed. It was in 1980. Not that it wasn't there. It wasn't there. It was just called something else. We thought about it differently. But in 1980 going forward, it's based upon 9 criteria. You have to have 9 different criteria. You have to actually 5 of the 9 in order to be diagnosed. What they capsulate is, I'm not gonna tell you all 9. It's very easy for you to Google and find the 9. But what they capsulate is a way in which these individuals or kind of interact with people, with relationships, and with themselves. They struggle with self-direction. They tend to lack focus. They get bored very quickly. They move from thing to thing. They also struggle with intimacy. They end up having a hard time showing up at relationships and being vulnerable, sharing who they are. They have a difficult time with empathy. So when it comes to understanding what it's like from another person's perspective, they're not aware, and that impacts them at a lot of levels. That also makes them very poor at self-reflection. It makes them, empathy, if you think about it, is really like our version of pain receptors, but for the psychological, emotional self. So if you put your hand on a hot stove and it starts to burn, you jerk back, you change it in order to stop the burning. Empathy does the same thing. It gives us a sense of how we're affecting other people. But if we don't have a good sense of empathy, we don't know that we're hurting them because it's hurting us, then we don't stop. We do things that are very cruel and callous and thoughtless. So not having empathy just makes us then very, very hurtful, makes us very blunt people in the world. We're not sensitive. We roll over everybody. So self-direction, empathy, intimacy, and I'm missing one more. I'm trying to think of what it is. So there's kind of these 4 realms that they struggle with, and that they're vulnerable and broken around, and as a result, that they then end up having a hard time having good work relationships and having a hard time with love relationships. And the other part with them is because of the fragile ego, they're very deceptive. They feel if you knew who they really were, then you wouldn't like them, that you would reject them. So as a result, they don't show up as themselves. They've learned to mask themselves, mimic other people, and parrot other people. So you don't really get a experience of this person as a person. You get experience of how they think you want them to show up in order for them to sort of insulate themselves from rejection. It's very sad. But what's hard is because all of this brokenness results in them in being very hurtful. They're very often callous, cruel, and then they leave this swath of broken relationships behind them. Do they know that they're narcissistic? Well, it takes self-reflection for you to know that you're messing up everything. They have to see it some way. So those that I know who've gotten help, come in for therapy, usually there's been some big crisis moment in their life that made them think, this is not working out. I'm actually hurting. It's hurting me. What I'm doing is hurting me. I'm losing a job, or I'm about ready to lose the kids, and usually they don't even have enough wherewithal to care about the kids in the way that you and I would think about that. But there's usually something that means something to them. Maybe it's the loss of money or an asset that they're really invested in, but something happens, and as a result of that, they end up realizing that they have problems. But it usually takes a crisis for them to be aware that there's something really serious going wrong. The difference is between a condition and a disorder. We often get mixed up on this when we think about narcissistic abuse, and narcissists in particular. We think that narcissism is a condition that's changeable, that's addressable, just like a flu is addressable or a cold. We think it's something that happens to someone instead of what it really is. So when the DSM-3 was created, they revamped it basically from the ground up. And one of the things that they did is they based everything that they put in it, all these conditions, as something observable. So when you go to DSM-3 or now the DSM-5, you're seeing a set of conditions and disorders that are based on observation. What happens when someone is depressed? What happens? What does it look like when you're anxious or when you have OCD? They separated them from conditions to disorders. Conditions are things like you getting a cold. There's a set of symptoms that you have. Your throat gets scratchy. Your nose starts to run. You start to cough. That's a condition. It's not a normal state for you. Something happens that takes over in a way, is how it feels to me. Takes over and gives you a group of symptoms, of signs, things that you can see that says to you you're having a problem. But you recognize at the time that this isn't you. You normally don't behave like this. That's what a condition is. Now, personality disorders are considered disorders, and disorders are not the same as conditions. Yes, we get kind of lazy and we use the word disorder as if it is a condition, but it really isn't. A disorder is what happens when you are being you and it doesn't go well. So, for example, that might be, say that you don't show up at work consistently. You have a habit of not prioritizing your commitment to your job. Or say you don't finish things. You get very distractible and you move from thing to thing. Maybe you're a person who has problems managing anger and you end up, as a result, blowing up and losing relationship after relationship. Narcissistic personality disorder is a disorder. It's you being you, but it creates this whole kind of trail of disaster behind you because of the way that you are being is problematic for everyone around you. That's where we get messed up. When we as victims think that this is a condition and not a disorder, we think then it can be fixed, just like we can treat a cold, or worse, or even maybe a better example, we can treat diabetes or heart disease. We do things differently. We go get exercise. We eat a different diet. We go see the doctor. We take our medication and we get better from heart disease or whatever it is. We often end up thinking when we're in these relationships that if we could just be different, be more, show up, care, love them better, or something, that we can fix the way that they're broken, at least the way that they're affecting us, so that we can end up being better. The problem is, it isn't. It's part of who they are. And that's something that's very, very difficult to change. It takes a lot of effort to change who we are. But I think that piece gets missed on victims. I think that's why we end up putting so much time and effort thinking that we can somehow, this is solvable, when it's really not solvable at all.